California's 49th District. Thank you to the City of Encinitas for hosting us. Thank you to Dr. Monica Soni for joining us, and to Steve for being willing to share your story this morning. We're now on day 3 of a government shutdown. That means 3 days of essential federal workers showing up without pay, 3 days of services that families depend on being disrupted, and 3 days of uncertainty for millions of Americans. And let's be clear, this shutdown didn't have to happen. It happened because those in power, Speaker Johnson in the House, Senator Thune in the Senate, and Donald Trump in the White House, refused to come to the table. When one party controls the House, the Senate, and the White House, they have the power to keep government open. If they refuse to negotiate, especially when health care for millions of Americans is on the line, that's on them. It's really that simple. Republican leaders are also trying to sell the public on what they say is a clean, continuing resolution, but there's nothing clean about it. It forces Americans to face skyrocketing healthcare costs if they're able to get coverage at all. And it allows the White House to hold hostage funding for things as basic as pediatric cancer research. A bill like that doesn't keep government open. It tears away at the very things that families rely on. And here's why this matters right now. The Affordable Care Act's enhanced tax credits are about to expire. If that happens, 660,000 Californians will be priced out of coverage. I'm going to say that again. 660,000 Californians will lose coverage. 5 million Americans nationwide will lose their ACA plans. Here in San Diego, that means tens of thousands of our neighbors could lose their health insurance entirely. It means parents in Oceanside, small business owners in Carlsbad, seniors in Solana Beach, families right here in Encinitas will lose their health care. And even if you get insurance through your job or through Medicare, you'll feel the impact also. Because when more people lose coverage, local hospitals and clinics, Scripps, Sharp, Tri-City, UCSD, are all left holding the bag. They absorb unpaid bills, and those costs get shifted to the rest of us through higher premiums and higher hospital charges. Nobody is immune. In September, Californians started receiving letters like this one with estimates of their 2026 health costs if the credits expire. These letters went out already. But then on October 15th, formal notices will go out. That means thousands and thousands of San Diegans will soon open their mailboxes and see that their healthcare bills are doubling. And on November 1st, open enrollment begins. So if Congress doesn't act now, those higher rates are going to be locked in. Once insurers set their prices, they're not going to undo that change. The numbers really are devastating. A new Kaiser Family Foundation survey found that a 60-year-old couple making $85,000 a year will see their health care premiums go up by $22,600 a year. Think of that. And the average premiums will more than double, from $888 in 2025 to $1,904 in 2026. Now here's the other thing you need to know. The American people aren't asking for this. In fact, overwhelmingly, they want to see these credits extended. Just to pull out this morning, that 78% of Americans, including a majority of Republicans, want Congress to extend these ACA tax credits. Nearly 8 in 10 Americans across party lines are saying clearly, do your job, protect our health care. And look, this is not abstract. This is about real families. This is about parents here in Encinitas being forced to choose between paying for groceries or taking their kids to the doctor. It's about cancer patients in Oceanside who won't be able to afford treatment. Small business owners in Carlsbad or Del Mar who want to provide health benefits but can't make the math work. One of my constituents told me the following, and we put out a call to our constituents to get their impression of all this and how it's going to impact them. One said, and I quote, "Covered California has been a godsend. With the ACA credits, I've been able to afford care for my family as I started my own business. But I'm terrified of what will happen if those credits expire." End quote. That fear is real, and it's about to hit tens of thousands of San Diegans if Congress fails to act. Now, one more thing. Let's remember, Back in 2013, during another government shutdown, what then citizen Donald Trump said, and I quote, "Problems start from the top and they have to get solved from the top. The president is the leader. He's got to lead. I really think the pressure is on the president," end quote. Those were his words. He was right then. I wish he'd remember those words now. Instead, what I see in Washington right now, I just got back and gonna head back there soon, is an administration trying to use this shutdown as an excuse to shrink programs they don't like, undermine public servants, mass firings of federal workers. It's illegal, unconstitutional, and it will not stand. So let me be crystal clear about this. We've got to negotiate a solution now. I've heard Senator Thune say, well, it can wait until next month, it can wait until the month after. No, it really can't. These letters here in California already went out. Final numbers will be sent out October 15th, and then the premiums will be locked in soon thereafter. So, I'm gonna say this as plainly as I can. Protecting health care for millions of Americans, hundreds of thousands of Californians, and tens of thousands of San Diegans is worth the fight. It's worth the fight. The American people want this fixed, Californians want this fixed, and I will not stop fighting until we get it done. And with that, I'd like to introduce our constituent, Steve Tash.
Thank you.
Thank you.
Hello, my name is Steve, and I get my health insurance through Covered California through the Affordable Care Act. I rely on those subsidies to afford monthly health care. The ACA was signed into law on my birthday. I'd like to think that was a gift by President Obama, March 23rd, 2010. By making the Affordable Care Act comprehensive, and I now get regular checkups, I get the prescriptions I need, and I finally get a peace of mind. But now that peace of mind may be going away. Since the ACA became law, Republicans have been trying to get rid of it. I think they're up to about 70 times trying to kill, amend, or change the Affordable Care Act. Thankfully, they have not been successful. Now Republicans are making health insurance more expensive for me and for millions of other Americans. They are refusing to extend the ACA premium tax credits, and they may even shut down the government for longer if they think they can cancel the rest of the premiums or the rest of the subsidies. I currently pay about $254 a month, but starting in 2026, nobody knows what I'm going to pay. If Republicans succeed in taking away the subsidies, my premium could go up $264 to $926 a month. I cannot afford that premium. I'm here to make sure that all Americans understand what's at stake. Without the ACA, what happens to protections for people with pre-existing conditions if they change jobs? What happens to free preventative care? What happens to ordinary working class Americans like me and help them afford health insurance premiums? It's time for Republicans to do their job. They must negotiate with Democrats. Congress, we elected you to protect our health care. Thank you, Representative Levin, for fighting for us and for our health care.
Thank you so much, Steve. And I think what Steve said is it's gonna go from $254 a month to $926 a month. Is that right?
Possibly.
Possibly, but that's what it would be. That's what it would be. And you got the letter. Yeah. Well, absolutely unacceptable. And with that, I want to introduce a great champion for healthcare in the state of California, Dr. Monica Soni, Chief Medical Officer for Covered California. Thanks for being with us.
Thank you. Thank you so much for having me. As mentioned, I'm Dr. Monica Soni. I'm a practicing primary care doctor and Chief Medical Officer at Covered California. Covered California is California's state-based marketplace, supporting nearly 2 million folks in accessing insurance with financial help. These are hardworking Californians. These are substitute teachers. These are farmers. These are hairstylists. The enhanced premium tax credits have been critical in helping folks afford it. These are folks who make too much money for Medi-Cal, are too young for Medicare, and don't get coverage through their employers. The enhanced premium tax credits in this district increased enrollment by 33%. That means right now, there are 34,000 folks in this district who are getting enhanced premium tax credits. And we heard about the staggering numbers that will increase if they are not extended. Across the state, for folks that have subsidies, that number is a 97% increase. We're talking about from December to January. Outrageous. Folks cannot afford that, as we just heard. The numbers are 400,000 to 600,000 Californians who will have to make a difficult decision and go uninsured. Folks who are in the middle of their care plans right now. Now, as I said, I'm a practicing primary care doctor. I practiced before the Affordable Care Act was passed, and I remember shift after shift, young folks coming in with advanced diseases, cancers that could have been prevented had they had insurance, early access to care, and gotten those screening tests. Please, let us not return to those days. Thank you.
Thank you, Dr. Soni. Really appreciate you being here. All right, with that, any questions, anybody? No? Which outlet are you with?
Box 5.
Box 5, fantastic. All right, say hi to everybody for me. Very good. No questions, anyone? Very good. Thank you all so much. Appreciate you coming.